people join normally as they do. Welcome to the Health Hub with Dr. T. As you all know, I'm Dr. T. I want to give a disclaimer like I always do before we get started. Information received on this page and during this live is general information only. So if you have any specific questions for yourself, for your loved ones pertaining to your health, please reach out to your healthcare provider, reach out to our providers that we have on here. On your own, but we want to make sure that you understand that this live is for general information only. So we want to welcome Dr. Michelle Housemore to our live today. As usual, I'm going to let her do an introduction about herself, her specialties, and then we're going to get right to it because it's going to be a hot topic. And so we have a lot to get to. So welcome, Dr. Moore.
Thank you. Thank you for having me on. I'm
Absolutely.
excited to be here tonight. Um, as she stated, I am Dr. Michelle House Moore. I am a pelvic floor physical therapist.
Yes.
I have been practicing for 14 years and
Ooh,
have been in private practice for 4 years. So I'm the owner of Distinctive Physical Therapy and Wellness Center out in the Woodlands, Texas. And I specialize in pelvic floor physical therapy. I'm board certified through the American Physical Therapy Association. And this is my passion. I love what I do.
awesome. I'm so thankful. As you know, I dabble into pelvic health, but I don't have a board certification.
Mm-hmm.
So once I get past my, I guess, general pelvic health, I'm looking for who I can truly refer to because this is a topic that affects both men and women
Yeah.
and children. For the first time this year, I had a referral for twins, and they're trying to figure all of that out. But it is just such a topic and a well-known topic that I think everyone needs to be educated on. So although you're looking at me, I'm a PT, I should know some of these answers. Imagine I am representing the audience. So I
Okay.
am going to ask questions that the audience will most likely want to ask. And the first is, what is pelvic health?
What is pelvic
When
health?
someone reads pelvic health, what does that mean? What can you tell us about pelvic health?
Okay, so yes, so pelvic health. So depending on who you ask, you may find a various amount of different definitions of what pelvic health is. But for me, pelvic health is basically the focus on health of the muscles in between your navel and right above your kneecaps. I'll say that. So that whole area. And so with pelvic health, we focus on your urinary system, your bowel and your bowel system, and sexual health.
Okay. So, that's a lot of different segments you just talked
Yeah,
about there. So, okay, so everything from below your navel to above your knee, and for both men and women,
for
which
both.
that is really, really important because there's a lot that happens
Right,
between below my navel and above my knee.
right.
Okay, so I want to talk about something that questions that I even have for that I get a lot of. I've gotten a couple of DMs about is leaks and bladder leaks.
Hmm.
That is something I'm getting a lot from, not just from those who have had a baby. We'll talk about pregnancy a little bit later, but just those that are having maybe some, I call them urge incontinence or stress incontinence,
Right.
things like that. What are some contributions to why most people have leaks?
So yeah, so what people can have leaks for a variety of different reasons, and leakage is not um, isolated to a specific age or a specific gender. We have men that have leakage, we have children that have leakage, and we also have adult women, which is our most common population that experiences urinary leakage. You mentioned a few types of leakage that you have. So we'll start with stress incontinence. Stress incontinence usually occurs when you have a stress that's put on your bladder. For instance, if you sneeze really hard or if you cough
Mm-hmm.
really hard. Sometimes people, when they get up out of a chair, they have leakage. So we call that a stress incontinence. A urge incontinence would be when you get the strong urge to go to the bathroom and you just don't make it. And that urge is just so overwhelming that you end up leaking on yourself. You also have what we call functional incontinence, and that's when you're bedridden and you just functionally cannot get to the bathroom. We have different interventions for that. And then we have something what you call mixed incontinence, which is a combination of the two stress and the urge incontinence. Some
Okay.
people
Ooh.
have some people have incontinence just with the strong urge to go, but they also have incontinence when they sneeze, cough, and laugh, or they run or they jump. So we call those things a mixed incontinence.
Okay. Oh wow. I'm gonna ask because we are gonna do some questions as we go so that I don't miss anyone. So will thighs be considered pelvic area?
Yes, so your thighs are considered your pelvic area because your thigh muscles
Mhm.
attach to your pelvic bone. So we call it the pelvic girdle. So that bone that's in your from your hips and what you're sitting on your pelvic girdle, and your thigh muscles they attach into that pelvic girdle. So when they attach into the pelvic girdle, if there's any dysfunction with those muscles, we typically may see some dysfunction or pelvic floor dysfunction with the urinary system, sometimes the bowel system, and sometimes the sexual system.
All right. Thank you so much for that. So when we talk about like incontinence, the leaks, right?
Mhm.
Whether it's stress or urge, is that because our pelvic muscles are weak, or what is causing us to have those leaks? Because I know personally, I've had it I think when I was pregnant, right?
Mhm.
It's almost like I have to go use the restroom. I know I have to go to use the restroom, but it's almost like as soon as I got to the bathroom stall and I was even trying to lock the stall, it's like I had to hurry up and
Yeah.
take off my clothes and pee. And like, is that part of incontinence? And what contributes to that?
Yeah, so we define incontinence as if it's, we all have leaked on ourselves before. Do we have a true incontinence? No, not really. It was a period of time that we had more pressure than our muscles could sustain. But it's not a true, we would say like, oh, it's an incontinence that is something that you need to get taken care of.
Okay.
We consider incontinence when it's bothersome. It's interrupting your daily life. It's something daily. You're having to wear pads and panty liners.
Mm.
Those things to keep you from having accidents on yourself. We consider that a true incontinence. You mentioned that when you were pregnant, you had some incontinence. So just think of if you took a balloon and you
Mm-hmm.
fill that balloon up with water, and we're going to pinch the bottom of our balloon and turn it upside down so where the tip
Mm.
of the balloon is facing downward and the top of the balloon, which is filled with water, is pointing upward. So we describe a stress incontinence as if you take the top of that balloon and you squeeze it. If you squeeze that balloon, what's going to happen? That water is going to come out.
Right.
But if you pinch that balloon tight enough at the bottom, when you do that squeeze, which represent a cough, which represent a sneeze, which
Mm.
represent pressure on the bladder, and that pressure can come from you getting up out of a chair, you rolling over in the bed. That pressure can come from you having a baby that's growing and sitting on top of your bladder. If you have enough pinch or enough squeeze at the bottom of the neck of that bladder, which would be your urethra, if you have enough pressure around your urethra when that activity happens, you won't leak. But if your pelvic floor muscles are weak and not strong enough to withstand that pressure, you will have a leak. And
Wow.
leakage occurs, it can occur for many different reasons. Primarily, the number one reason is childbirth. Because of the trauma that the pelvic floor muscles have to go through when women deliver babies, particularly vaginally.
Right.
But you could also just genetically be predisposed to having weak pelvic floor muscles. Your
Mm.
mother had weak pelvic floor muscles. Your grandmother had weak pelvic floor muscles. So therefore, you just genetically have weak pelvic floor muscles. You could be constipated. Being constipated
Mm.
and straining while you're in the bathroom will cause your pelvic floor muscles to weaken. You have gymnasts. We see young girls who are gymnasts and they're constantly flipping and pounding and jumping and doing all those things. Those things make you have can weaken your pelvic floor. So it's just surgeries, having surgeries that go in and damage the muscles. Those can cause you to have a weak pelvic floor. Menopause, when we get older and we start to go through menopause, our muscles they start to waste away. We call it a vaginal atrophy that occurs, and that will cause you to have weak pelvic floor muscles. So there are a variety of different reasons why people have pelvic floor muscle weakness, which can lead to leakage.
Leakage. Okay. So someone said, is leak typically, which I think you kind of touched on this, is this leak typically a disorder or is it normal? But like you said, it all depends on what kind of leak it is and if it affects your activities of daily living, you moving around. And
Right.
if you have any questions about your leaks or leaks of a loved one, definitely going to the doctor and having them, or even getting a referral to a PT, a pelvic floor PT, to do a full evaluation. So I
Right.
think that's really, really important. Super Mommy underscore Noni said, what happens to your pelvic muscles over time if you have a bad habit of holding pee? That's a very good question
Mm-hmm.
because as women, I almost feel like we tend to want to hold our pee quite a lot. I know if I'm doing 1,000 things, I'm most likely, I could have peed probably 30 minutes
Mm-hmm.
earlier, but it's taking me because I'm so busy.
Mm-hmm.
It's taking me a while to get to there. What are some long-term issues that can cause?
Sure. So we see usually when people hold urine, in order to hold your urine in, you have to contract your pelvic floor muscles.
Mm.
And so when you're contracting for long periods of time, you're not allowing yourself to completely relax your muscles so you can empty your bladder. What we typically see is the opposite of what we would see in a person who is leaking urine. We would see a person who be on well, that would be on the pelvic pain side. And that's because their pelvic floor muscles are hypertonic. And when the muscles become hypertonic, then you start to develop knots and trigger points in your muscles. Then you start to be able to have the problem of incomplete bladder emptying because you've been holding for so long. You don't know how to properly relax your muscles. So we see a lot of that. Also, holding urine for long periods of time can set you up for more frequent urinary tract infections. So we do encourage people to empty their
Mm.
bladder. When you don't have to go every 30 minutes, but we want you to at least be every 2 to 3 hours. You should be
Okay.
emptying your bladder. If you're holding for 5, 6, 7, I've had patients holding 8 hours. Um,
Ooh.
you're setting yourself up for possibly to have urinary tract infection, and you're setting your muscles up because your muscles have to hold that urine in to be hypertonic and to cause knots and trigger points, which will lead to pelvic pain.
Oh, wow. 8 hours. I do know a loved one, I shall not mention names, who does not like to use the restroom outside of the home. And so would kind of want to hold it and be like, oh, I'm only comfortable at home. But I'm almost like, how could you go all day? Which makes sense because, and then they don't want to drink as much. So they don't want to go use the restroom. And
Right,
then once that happens, it's like you're more prone, you're either dehydrated or like you say, you just put yourself more at risk for having a UTI.
right.
So thank you so much for explaining that. I think another thing which maybe falls under leaks, and I'm no expert, so I need your help with this, is when they don't fully empty out their bladder. So I think that's also where you can have some leaks, where some people almost feel like they have to wear a liner or a pad or something because throughout the day, as they're moving, sneezing, coughing, running, opening up the door, pushing something heavy, they tend to kind of leak a little bit more.
Right. So yeah, so that's why you want to make sure you completely empty your bladder. And you said something earlier. You said you have a family member who does not like to use the bathroom out in public. So many of us don't like to use the bathroom out in public. And when we do go out in public, we will squat. And I'm guilty of it. We squat over the toilet because we're not going to sit on the nasty toilets.
Yes.
However, that's the incorrect way to empty our bladders, because when you're squatting, just think about it, your muscles have to hold you up so that you don't fall down. And when your
Mm.
muscles are holding you up, that means that your muscles are not completely relaxing to allow your bladder to completely empty. So, yeah, you
Don't
want
squat.
you don't
So
want to,
wrap the
if you
toilet
can,
like a mummy.
if you can,
Wrap
wrap
the
the toilet.
toilet like a mummy and then sit
Right.
on it.
You
But don't
can,
squat.
but don't squat if you, and I'm guilty. Very,
Yeah,
but because I'm not sitting on no nasty toilets. However,
absolutely.
the best practice is that you want to sit down so that you can completely empty your bladder. Because what you don't want to happen is you don't want to have just gone to the bathroom and then you get up and you go out and you jump and you sneeze and you're like, wow, I didn't even know that was still in there. Well,
Right.
you did just go to the bathroom, but you did not completely empty your bladder.
So do men have this issue too?
Men
Do
do
men
have
have an issue with
so
completing their emptying out their bladder?
men do have this issue, not as
Mm.
much as we women do. And the reason is because if you look at the male anatomy and compare it to the female anatomy, men have longer urethras than we
Yes.
do. Our urethras are very short.
Hmm.
The male urethra has to run around like a snake, if you get me. And it's long. They have a longer urethra. They also have a prostate, and we don't. So that
Mm.
prostate actually acts as a stopper, as a cork around the neck of the urethra, and it helps them not lose urine. So if you
Okay.
notice, men can hold it a lot longer than we can. If
Yes.
you're ever out
Yes.
in public and you go to the bathroom, you will notice that the woman's line is way out the door. And the
Yes.
men go in and out because they can hold their urine a lot longer than we can. And that's because by the time they get the urge to urinate, that urine has had to have traveled down a long tube to give them that urge that they need to go. Whereas ours is right there. We get
Oh
the
wow.
as soon as our bladder is full, it comes down. We get the urge to go
We
because
gotta go.
we have a shorter urethra. So typically, we see more women than men, but when we do see men, it's typically after they have their prostate removed.
Oh.
I see so many men after that prostatectomy, where they had have to have their prostate removed due to prostate cancer. They leak, and they
Okay.
leak bad. They leak really bad. I always recommend for my men, especially the ones that I know that are going into have surgery, if I'm able to talk to them beforehand, or if they get a referral from the urologist. A good urologist will send their patients to PT, pelvic PT, before they have that surgery, because the studies have just shown that if you start doing your pelvic floor muscle contractions prior to the surgery, you have better outcomes on the back of the surgery. But when you're trying to rehab and
Mm.
trying to activate and contract muscles that you've never used before, because men, like I said, they never really have to use them because they don't really have the problems that we have. But when you're trying to contract muscles that you've never used before after someone has gone in and cut on you and cut your nerves, it becomes very difficult, and it can be very frustrating for men. And men do not like to be in pelvic floor therapy.
Of course
They
not.
do not like wearing undergarments. They do not like the idea that they are leaking urine.
Mm.
So that's when we typically will see it for men, is after they have that surgery. But if they get in beforehand, we usually see way better
Be
outcomes.
good. Okay. And that's the vasectomy, right?
Not the vasectomy, but the prostatectomy,
The
where they remove
prostatectomy. Okay.
their prostate due to prostate cancer.
Okay.
Yeah,
Okay. I wanted to clarify that because I was like, wait,
yeah.
did I have vasectomy? Because
Not the
I got a
vasectomy.
couple of people I got to call. Okay.
No, vasectomy. The prostate still remains during the
The
vasectomy.
same.
They
Right.
just cut off they block a little. They block a pipe.
Right.
They block a tube.
Literally.
But no, they still have their prostate, and if it's functioning right, it's there. It's like a cork bottle. It's like the cork at the top of a wine bottle. That's what the prostate serves at. But when they take it off, when you take that cork out, it flows.
Oh, okay.
It flows.
We're going to come back to that. So, this next question kind of segues us into our next section where she said, ooh, 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 I just missed it. Okay. Does having a strong pelvic floor help enhance your sexual performance?
Yes, it
So I
does.
do want to talk about sex a little bit,
Okay.
but before we get to the muscles, I want to talk about sexual pain.
Okay.
I know personally in my practice, I've received some referrals, or even some patients have told me, hey, when I have sex, it's painful.
hmm
So, coming from you, should sex be painful? And if it is painful, what are your recommendations? What does that not like naturally, where does that take you?
Okay. So to answer your first question, should sex be painful? No, sex should not be painful. It has been designed as a pleasurable act,
Mhm.
and it should not be painful. If you are having pain, it's important to find out the reasons why you're having pain. Typically, in my practice, what I see people have pelvic pain, their muscles are just really, really tight, meaning that they are holding a lot of tone and a lot of tension inside of their pelvic floor muscles. They just don't know how to relax those muscles. And when you hold a muscle in a shortened position for a long time, that's when we start to see knots and trigger points develop. It's just like if you were holding your shoulders up like this, yeah, and you held it like that, you'll start to get knots and trigger points into your shoulders. So same thing with the pelvic floor. If you're holding a lot of tension into your pelvic floor, whether it's from anxiety, whether it's from past sexual trauma, whether it's from a surgery that you just had, and now your body is trying to guard that area. We see that when your muscles are tight like that, trying to put something in there to touch and put pressure on there causes you to have pain. Vaginal dryness will cause you to have pain. Usually we see
Mm.
that with menopause, women that are going through menopause. And also with menopause, you have what we call, again, vaginal atrophy, which makes the muscles paper thin. So they can't tolerate that friction that occurs during penetration because they're usually dry and the muscles are just so thin because the estrogen levels have depleted down there in the vaginal area. So those are the what we would see typically with pelvic pain, a
Okay.
patient who has
So
pain with intercourse.
this next question, and I think we could tag team this a little bit. It says, how can we make those muscles stronger? So, like, I would kind of talk about the genetics of, or I guess the origin of muscles. Every muscle can be strong, just
Yeah.
like every muscle can be weak. It's
Mm-hmm.
almost like, I hate to compare it, but it's like your bicep.
Mm-hmm.
Just as much as you work your bicep, you do strength training, resistance training, things like that. You eat the right protein, all of that to build that muscle. Same thing for your pelvic floor. So there are exercises, there are ways to strengthen your pelvic floor muscles. So I don't know if you have any on top of your head that you typically give. I know sometimes it's hard to not show it,
Yeah.
but if you have any that you
So
could.
okay, so just to give you kind of an analogy of how to strengthen your pelvic floor and to make sure that you're strengthening the right muscles. One test that you can do, well, to strengthen your pelvic floor muscle. Let's start there. We do Kegels or a pelvic floor muscle contraction. That's pretty much the first line of defense for pelvic floor muscle strengthening. If you have a contraction, you can do Kegels to help strengthen your muscles. Now, you don't want to just start doing Kegels. You want to get the appropriate exercise prescription for your Kegels because your muscles are different from somebody else's muscle.
Mm.
So if you go online and you read a blanket prescription, they're tailoring that for somebody else. You may not be able to do that. Um, Another thing you can do is you can add vaginal weights
Mm.
to those muscles. So just like you would go to the gym and grab a dumbbell to build up your biceps, you can grab a pack of vaginal weights and stick one in there and start to do your Kegel exercises, and that will help lift and give that muscle some resistance.
Oh,
So
that's awesome.
that's another tip and trick. But the best thing to do is to actually come and see someone that can actually give you an appropriate prescription, and also to make sure that you are doing your Kegel
Right.
pelvic floor muscle contraction properly. A lot of people are squeezing their butt cheeks together. They're
Mhm.
squeezing their thighs together. They're squeezing their
Everything but
stomach
the
together.
pelvic floor.
They're doing everything but their pelvic floor, and the pelvic floor muscles will not strengthen
Mhm.
if you are doing that. And you have to be consistent with your exercises, just like any other muscle in your body. If you're going to go and build up whether it's your arms, your legs, or you're trying to get a six pack, you have to work on it.
Yep.
But the same thing with your pelvic floor muscles. You have to consistently work on strengthening your muscles, and that's how you get them stronger. If you ever want to know if you're doing it properly, a test that you can do is you can try to cut off the flow of urine while you're in the bathroom. You don't
Ooh.
want to practice. You don't want to practice, make that a habit of practice because you don't want to practice doing your Kegels because the ultimate goal when you're in the bathroom is to completely empty your bladder.
Mhm.
But it can be a test for you. So just a little test that if you can start a flow of urine and cut off that flow, then you know that you're squeezing the right muscles and you know you have enough strength to cut off the flow. I always tell my patients to pretend like they have a milkshake down there, a straw, and go ahead and pull like you're pulling that milkshake up.
Oh,
That's usually a good cue. And the other thing is pretend like there are marbles on the ground and you're trying to pick up some marbles.
wow.
So typically that helps people find those muscles.
I feel like I'm I'm doing it. I'm trying to. I'm like, wait. I'm trying to envision it. I'm trying to say, can I pick up marbles? Can I really?
Yeah, just pick up the marbles off the floor.
Someone said, I so judge when I hear the next stall using the toilet seat paper. I'm like, yuck, you sit on that, but I guess we should. I guess we should. I guess we should.
You should.
I'm gonna work on it.
That's best practice.
Mentally, I'm gonna work on it. Super mommy underscore Noni, please keep your questions because she said it. She said, I'm just asking questions people might not ask. And I think that's why I love doing this lives is please ask where anything that comes to mind. There is no judgment. There is no anything because information is key. I feel like knowledge is power. There are
Yeah.
people that are moving around here in pain or with some discomfort and they don't know who to go to. They don't know which
Right.
doctor or which therapist could best help them. So I love the questions. Keep asking the questions, please. You guys just keep adding it. We'll answer as we go. So, okay, we talked a little bit about sexual pain. We talked a little bit about, yes, you can strengthen those pelvic floor muscles to help your sexual pleasure because it is supposed to be pleasurable.
Right.
And if it's pain, if it's discomfort, you don't want that. Someone said breathing. Breathing is also actually part of therapy.
Yes.
We're so used to when doing exercises, when working out, we tend to just hold our breath. So, yes, breathing plays a big role in making sure that you're doing it well. I don't know about you, Dr. Moore, but for my patients, I tell them if you can talk, if you can breathe while performing your exercises, then I know you're really doing it. But if you
Right.
have to be mute and we don't talk and you're just so focused on it and you don't say anything, then I'm like, I don't think you're really doing it how
Mm.
I want you to do it.
Yeah. So the interesting thing about breathing in your pelvic floor muscles mimic or they follow your diaphragm.
Mm.
So if you take a big deep breath through your belly and you take a deep breath and you fill your belly up with air and expand that diaphragm, your pelvic floor muscles will expand as well.
Mm.
If you squeeze your pelvic floor muscles and you hold them, let's just say you're squeezing, you're doing an exercise and you're holding for a count of 5, your diaphragm will tend to want to hold for that count of 5 too. So you have to actively tell yourself, let me breathe. Whether it's a short controlled breath, you need to breathe while you're doing the exercises. And as you get stronger and you're able to hold for a longer period of time, for instance, and once you get to where you can hold for a 10-second contraction, you want to do that 10-second contraction, but you don't want to hold your breath for 10 seconds. You want to do that 10-second contraction, hold that pelvic floor really tight, and then just kind of do a slow control breathe. Because your pelvic floor muscles and your diaphragm, they want to follow each other. And that's why people tend to stop breathing when they're doing those exercises.
Wow, I didn't even look. I didn't even know that much.
Yeah.
That is wow. Thank you for that. I am even going to rewatch this and actually learn from it. So thank you. Thank you for that. I have a question.
Mhm.
This is one of the questions where I call like a raw question, but
Okay.
we're all adults here. And just like some of our listeners, they want to ask certain questions that I think they don't want to really say. So I'm going to say it. I don't mind
Okay.
it. So let's say you're having sexual intercourse
Hmm.
and it's a heterosexual intercourse and the man is inside of you. Can you strengthen your pelvic floor with trying to squeeze and relax? Or am I just doing that for pleasure?
Well,
Can I call that
that's
therapy?
a good question. Um, so strengthen your pelvic floor muscles. You're probably not going to get a whole lot of strength going.
Okay.
But you can definitely do a pelvic floor muscle contraction while during penetration. It's not going to strengthen your muscles because your muscles are on stretch. So just think about it. Your muscles are not in an optimal position to strengthen, but you can provide some extra pressure and some extra, I guess, sensation,
Right.
if you will, by doing a squeeze. Also, squeezing, helps bring blood flow to the area, and all that is good. for your sexual health. But as far as strengthening, just think about, the vaginal canal is more of a cylinder. And when you put something in there, let's just say, I'm gonna use a can as an example. You put a can inside of a cylinder that's not as wide, those muscles will stretch. And when you
Mm,
have stretched muscles, if you were at the gym, and you were working your biceps, you wouldn't work your biceps from a stretched position.
mhm.
You would work it from a neutral position, and then you would shorten it, and then you would lengthen it, and shorten and lengthen it. Your muscles are put on stretch into a um, stretched out position, so they're not able to contract or shorten like they need to
Okay.
actually build strength. But you can, like I said, you can increase some pressure, which in turn may increase some sensation and pleasure.
Right. Okay. I'm gonna call it therapy with a small T. I'm doing my
Small
my
T,
therapy
yeah.
exercises. It's not the big PT, it's a small PT. So let's talk a little bit about vaginal dryness,
Okay.
because I think that's important, right?
Hmm.
Sexual sex is for pleasure.
Hmm.
And let me ask it this way. Do you get referrals or patients that come to your clinic saying that, maybe they're not on menopause yet, or, but they're having some vaginal dryness, and which kind of can
Right.
also make sex painful,
Right.
right? Are
Hmm.
there any general tips, anything they can do to increase secretion or anything like that for them? Or do you not even address that at all?
So
I'm
typically,
getting real today, y'all. I'm talking today. I'm
so
talking.
so typically, we usually see vaginal dryness when there's a hormone imbalance. Uh,
Okay.
and that's more on the end of someone who's in perimenopause or they're in menopause. Okay, that's when we typically see that. Normally, you don't see a young, healthy, hormonally balanced female who has issues with dryness. Now, they may have issues with libido, which inhibits them from, being able to get moist, if that's the right way to say that. But and usually that's caused by there's some type of trauma that they've had in their past. There's maybe some underlying mental health thing that needs to be addressed, or the relationship that they're in is not one that they feel that they want to be intimate with. So you have some
Mhm.
underlying issues that are usually present when you have a younger female who is dealing with vaginal dryness. My recommendation for vaginal dryness is, if it's a female who is not in menopause, would be to use some lubricant.
Okay.
You can get lubricant over the counter. My
Hmm.
recommendation for lubricant is water based,
Okay.
because you want to use something that's not alcohol based. Most of the lubricants that they sell in the pharmacies, like a KY, they usually have an alcohol base to it, which contributes to vaginal dryness. So, and people don't know that, and they use the alcohol base because it's better for their production of product. But the long term, after you have it in there for a while, it kind of works against you and can contribute to some of the dryness. But as a younger female who is, let's say, not menopausal, their hormones are imbalanced, it's not going to really affect them as much as it would if it was a female who is in menopause. So with menopause, KY, those over the counter lubricants that are alcohol bases, I'm strictly against those. You
Okay.
should not be using those. You should use a water based lubricant. And so
Okay.
typically that will help. Some people use coconut oil. Had patients
Oh,
use Vaseline, grapeseed oils, and some of those other oil type things, and you can use that as well. They won't dry you out. The most important thing for me is not drying you out.
okay.
But my go-to would be a water-based lubricant. If you are in menopause, contact your OB-GYN or your PCP and get on some estradiol cream or some type of estrogen uh, cream to put in the vaginal area. That's if you're not having any other underlying health conditions. That would be my recommendation for that.
Thank you for that. And and like we said earlier too, if you're having anything like something that's unusual, your doctor hasn't told you you're in perimenopause, you don't feel like you're in menopause, go see your doctor, let them do a complete blood work, let them do what they do, And then, you know, you can always ask for a referral and just say, hey, I heard this PT talk about it. Do you think I could benefit from pelvic floor PT? Most doctors are very for it, at least the doctors that I know, especially if you bring it up and say something that you're interested in doing. So definitely don't just take it upon yourself to say, oh, I'm having vaginal dryness today. I'm in menopause. Let's calm down.
Yeah.
Go see your doctor. Let your doctor do their blood work and
Yeah.
all the things that is needed, and then they can educate you appropriately and send appropriate referrals.
Yeah.
Okay, let's switch gears. Let's switch gears to men.
Okay.
Why do men come to pelvic floor PT? Apart from, let's say, you know, they've had their prostate removed, what are some other things that you see or other diagnoses that you get for a man to come to pelvic PT?
So typically, men come to pelvic PT. They come for, bowel issues,
Okay.
constipation, or they're having fecal incontinence. We see men, like we said, for urinary leakage after prostate removal. We see men for erectile dysfunction. So typically have a lot of patients who have erectile dysfunction and they come to pelvic floor PT. And then the last thing I usually see for men for is pelvic pain. You'd be surprised. Men have pelvic pain just like women do. And a lot of those men have that pain because they are working out a lot. That's what I've seen. Um,
Oh.
they do a lot of working out and they're lifting a lot of heavy weights. And in order to maintain that weight overhead or whatever they're doing with that barbell, whatever they're doing, they're having to contract their pelvic floor muscles in order to stabilize
Hmm.
their cells.
Oh, wow. I didn't even think about that. I did not think about that. So those that are, you know, really just hardcore working out, increased resistance, they're actually working their pelvic floor in overdrive. So
Overdrive.
they may come into pelvic floor PT for that.
Right.
Oh,
So
so
we call
if
that an
do
overactive pelvic floor.
overactive pelvic floor.
Mhm.
So if, how do I say this? Do you just recommend that they slow it down, or do you, you know, how do you typically address that generally?
So I address it. So it depends on what's going on. Typically this involves a rectal exam. So I need to assess their pelvic floor muscles just like I would assess a female's pelvic floor muscles. I just have to go rectally because they don't have a front door. We got to go through the back. But we like to see what are the muscles doing? Are there knots? Are there trigger points in there? Because they get knots and trigger points in their muscles just like we would. So
Right.
there's knots and trigger points in there. We want to go get those out. And then teaching them how to breathe properly, teaching them how to relax their pelvic floor muscle. My recommendation is that if you lifting weights and you're lifting and they're lifting like 2 and 3 times their body weight, uh,
Hmm.
if you're lifting that much weight in this, you're doing it for leisure, you might want to find another leisure activity. If you have to do that, then you want to make sure that you're definitely stretching those muscles, those thigh muscles that are attached to the pelvic girdle. You want to make sure that you're doing proper breathing when you are doing your exercises, and you want to make sure that you're stretching out your pelvic floor muscles after you do that because your pelvic floor muscles are tight, and when you're doing those exercises, you're holding that tone in there and you don't know how to get it out. And usually that's when we see the problems for them.
Wow. I promise you, I am learning. I am learning. Prince Cato did the little cross. Okay. Clearly, you're gonna be stretching today. If you have a spouse or a loved one, have them stretch you out. Okay. Have them stretch you out tonight. Erectile dysfunction. You touched on erectile dysfunction.
Mm-hmm.
What, I mean, obviously, I know for a male to come to therapy for that, that means it's bad. That
Yeah,
means it's
but
something that
it's
they're
bad.
probably embarrassed on.
Yeah. Oh, they're so embarrassed when they walk in the door. I have to tell them like it's okay.
It's
Uh,
okay.
it's okay. But so with erectile dysfunction is usually linked to pelvic floor muscle weakness.
Mhm.
So interestingly, with when people have prostatectomies, when they get those prostates removed, it is really devastating for the male pelvic floor. The first thing we usually see is leakage, but depending on the skill of the surgeon, that erectile dysfunction comes right after that, because it's
Oh,
so hard to preserve the nerves that innervate the prostate when they have to remove that prostate. And that usually, we typically see that go hand in hand,
mm,
urinary leakage and erectile dysfunction
dysfunction.
with after that prostate surgery. So it's kind of devastating to a man's ego, to say the
Wow.
least. But you also have men who have erectile dysfunction who still have their prostate.
Okay.
Usually, that's a sign of pelvic floor muscle weakness. So, for a man to maintain an erection, they have to have proper blood flow. That's why you have the Viagra's, the
Hmm.
Cialises. Those medications, their mechanism of action is to increase blood flow to the penis, and that's the only way they can maintain an erection. Well,
Right.
when men are having intercourse or they're getting aroused, their pelvic floor muscles do need to tense up to a certain level
Right.
to push blood to the penis. And once that penis is engorged with blood, the muscles sit on a nerve, on not on a nerve, on a vein, which is, I think it's called the dorsal vein. They sit
Hmm.
on that vein. And if the muscles aren't strong enough to maintain pressure on that vein throughout, then you have problems. And so we see men for that, and we work on pelvic floor muscle strengthening. And typically, if there's no nerve damage, we typically can get them more control
Okay.
that way by strengthening the pelvic floor muscles.
Ooh. Y'all gonna have to watch this on YouTube. I'm telling you, I'm gonna upload it. Y'all gonna have to go back and watch it on YouTube because this is some great information here. Okay, I'm gonna switch gears again. So I was stalking your page because that's what I do. I
Uh-huh.
like to look at what people are doing. I'm like, I want to learn about this. So there was one thing that you touched on was pregnancy.
Uh-huh.
For I think in one of your general tips, you had different things. It's a flyer, and in one of it is for people that want to get pregnant. They go to pelvic PT. Let's say I think it said if you want to be pregnant, if you're pregnant or were pregnant, pelvic PT is for you.
Mhm.
So fertility is a big thing in our generation.
Mhm.
We're definitely going to have a fertility specialist come on board to talk more.
Mhm.
But why would someone say, okay, I'm trying to have a baby? I've heard of the acupunctures. I've
Mhm.
heard of all the different, the prenatal massages, the things that, you can do to kind of help get your body prepared for a baby.
Mhm.
Why would somebody come to pelvic PT if they want to get pregnant?
That's a great question. So I haven't dived into the infertility side of pelvic PT. I know that that's a up and coming area that a lot of people are
Mhm.
focusing on now, and kind of even specializing in the fertility side of pelvic PT. But that's not my area. But the I guess the school of thought behind how can pelvic PT help with fertility. Fertility comes and can occur for many, many, many different reasons. Sometimes PT is the right answer, sometimes it's not. It just depends on what is the reason for the infertility. The PTs that I know that are working with people who are infertile or trying to conceive, they're looking at more of, is there a scar tissue issue
Mm.
that's blocking, let's say, the fallopian tubes, and keeping the egg from traveling down to the uterus. If they're doing that, they're doing a lot of visceral mobilization to the reproductive organs to help facilitate the sperm and the egg meeting, or open up those passageways so that the egg can travel to where it needs to travel. On the other side, if you're having pain with intercourse, you're probably not going to be doing the things that you need to do
Right.
to achieve pregnancy. So, that ties back into doing pelvic PT to help really reduce that pain with intercourse. So those are the things that I would say that the infertility specialty before PTs are working on. They're looking at more of that visceral mobilization to, break up any scar tissue, or to help facilitate those reproductive organs with achieving pregnancy.
Oh, wow. Awesome. Thank you for that. I think I read somewhere same thing about, there could be some tightness and things need to be released. And, just like you keep saying, it's a muscle, and how you'd want to stretch a muscle and work a muscle. That also kind of helps with movement of the sperm towards the eggs and into the uterus and things like that. So thank you. This has been super, super informational. I am blown away. Like, I am going to go back and watch it, because there's some things that you touched on that I never thought of in that way.
Mhm.
And I think will help me be a better clinician also. Let's say someone wants to come into your practice today,
Yeah.
and they just come in and say, I'm having this pain, or whatever the case may be. What does an exam look like? Are they expected? Do you do an internal vaginal exam? Is it all external? What should they expect when they come in?
Okay. So yeah, so when you come into my practice, we come in, we go into the room and we sit down. I just unload. I ask you all of the different questions that I feel like I need to get a better understanding of what your condition entails and how it's affecting your life. I also like to ask people, what are their goals? What are you trying to get back to? What are you expecting to get out of therapy? Then I like to teach. So I will go in, I have my pelvic model. I will sit down, I will show you, hey, based on the symptoms and the condition that you just described, this is what's going on with your body. Because I like when people do that for me. I like when they show me
Same.
why I'm going through this.
Mhm.
Because then when we're working on something, then if you know what I'm working on, then you're more likely to work on it because you know what the end goal is and what we're trying to do. So I like to take my model and I'll pull out those organs and I'll show you how the pelvic floor muscles work with your bladder, how they work with your bowels, how they work with your vaginal opening, and how they work during your pregnancy. I like to show people those things. Once we get to that part, then I like to explain that this will entail typically a pelvic exam. I like to collect data. I feel like I have to know what your muscles are doing
Right.
in order for me to properly give you the correct things to do. I can guesstimate or I can guess what your muscles are doing, but I don't want to give you exercises for strengthening when we find out later that you had 20 trigger points in your pelvic floor. Now we just kind of made that worse. We don't
Right.
want to do that. So I always do a pelvic exam if with the patient's consent, if they're comfortable with it. I do a pelvic exam. I assess their pelvic floor muscles. I assess their tone. I want to see, do they have good tone in their muscles, or are their muscles flaccid? If the muscles are flaccid, that lets me know that, maybe there's some type of nerve damage that occurred, during a delivery or something.
Mm.
I want to see if the muscles are tight, or are they firm? Are there any knots or any trigger points inside of the muscles? That lets me know what areas I need to work on. And then I always assess their function of the pelvic floor muscle. So I'm assessing strength. So I'll have the patient squeeze.
Mm.
I'll have them squeeze again, and to see, just how much pressure can they generate. We have a scale that we use that they teach us in school that we use to measure what proper strength looks like, what good strength is, what bad strength is. So I always measure that. I also assess their endurance, pelvic floor muscle endurance. How long can you hold a contraction when you squeeze? Usually people who leak urine can't hold very long.
Mm.
People who can't make it to the bathroom, when they get an urge to go to the bathroom, they typically cannot hold a contraction that long. And so that will be one of our goals. Where are you now? And our goal will be to work you up to a second hold where you can sufficiently make it to the bathroom without leaking. And then the other thing that I check for your coordination. How fast can you do a contraction in a 10-second period? How many contractions can you do in a 10-second period? I want to know what your coordination of your muscles are. Can you control your muscles? Can you release your muscles?
Ooh.
Can you push your muscles down? Can you relax your muscles? Some people can contract their muscles, but they cannot relax them.
You're right.
And then I have patients who can relax their muscles, but they cannot contract them. And so those usually when we have those issues, we see those problems. If they can't contract, then typically they're a leaker. If
Mm.
they can contract, they can't relax, then typically they're having pain. I
Wow.
also check their pressure. I have them do a cough, I want to see, are your muscles responding to that cough, or how your muscles are responding to your cough. And then last thing I check for is I check for prolapse to see if their bladder is coming down, if the vaginal canal is coming down, if the rectum is coming out. So those are the things that I check for when I do my exam. And then after we check and we get all the data that we need, then I'm able to write you the right exercises to start working on at home. I always give home exercises and homework
Always.
for people to take home so that they can start working on it. And then we get your appointment scheduled and give you a treatment plan, and we set our goals. And then you come back in and we get started on our sessions.
Wow, that's a
Comprehensive exam.
comprehensive exam. Thank you so much. Are you accepting new patients? How can people get a hold of you if they have any questions?
So my website is www.distinctivept.com. The clinic is Distinctive Physical Therapy and Wellness Center. I am in the Woodlands, Texas. The address is 4840 West Panther Creek Drive. I'm in Suite 105. We're in the Woodlands, Texas, 77381. Our office phone number is 281-394-4704. Or you can reach me by email. It's info@distinctivept.com. Oh,
Awesome.
and
Awesome.
follow me on Instagram, the Pelvic
Yes.
PT Doc, and then I'm on Facebook, at Distinctive Physical Therapy and Wellness Center.
Awesome. Thank you so much, Dr. Moore. Thank you, thank you, thank you. I really can't thank you enough because like I said, I dabble in pelvic floor, but this has really, really opened my eyes out. So thank you so much for sharing your knowledge. Thank you for your time. As I said earlier, all information given on this live is general information only. If you have any specific questions to your health, to the health of a loved one, please reach out to your healthcare provider. You can always ask for a PT referral. You can ask for a pelvic floor referral, and they should be able to support you. But thank you so much, Dr. Moore. Like, this has been awesome. I'm going to upload this into our YouTube channel at the Health Hub with Dr. T. Please watch our previous lives. We've had some amazing lives, and I just feel like we're just hitting it out. Like, this is amazing. If you have any questions, please feel free to send me a DM at the Health Hub with Dr. T. But thank you all so much for spending your Monday evening with us. Thank you, Dr. Moore, for your time. Thank you for your knowledge. Thank you. We're definitely going to have you back. I feel like
Yeah.
everyone's coming back at this
Yeah.
point because there's so much more we can dive into. But I thank you so much for your time, and I thank everyone for joining. And that's all that we got for today.
Well, thank you for having me.
Absolutely. Please share our page with everyone. Share our page with your stories. Our goal is to get to 1,000. So please follow the Health Hub with Dr. T. I know this live is on my personal, but that's due to some Instagram rules. But please follow the Health Hub with Dr. T. We're going to bring more information to you all.
All
Thank
right.
you so much.
All
Thank
right.
you, Dr. Moore.
Thank you.
Have a good rest of your evening
You
and a
too.
blessed week.
You
Bye,
too. Bye.
everyone. Thank you.
Bye.